Good afternoon. My name is Jeff Eaton. I'll be doing a presentation on drug testing student athletes. This is for Kinesiology 777, Issues in Kinesiology with Dr. Ave. The debate is whether to drug test student athletes at the high school level. I also take a look at the college level and different aspects of that. Nowadays, drug testing is in the news at the professional level as well as the college level. You have different drug-related arrests, newsworthy items, Olympics, and so forth. What we're going to get into is both sides of it, the positive and the negative aspects of drug testing athletes. One of the things against it is invasion of privacy for the student athlete, especially at the high school level. Students don't feel that they need to be drug tested. You also have issues of public schools versus private schools, the expectation and implementation of it. One of the other negative aspects is the loss of participation for the violators. The price of the drug testing each athlete is too expensive for many of the budgets. Some of the positive outcomes: it's good promotion for a school, raises expectations of athletes within a program. It does prepare student athletes for policies of the NCAA at the four-year schools. It also prepares student athletes for future job opportunities. Many professions drug test, drug screen during employment. Also raises awareness of drug abuse and issues connected with it. And lastly, it improves safety for all students. In 1995, U.S. Supreme Court ruling in support of random interscholastic student-athlete drug testing. More schools than ever before have begun mandatory drug testing as they battle drug abuse by their students. Most student drug testing programs consist of mandatory testing of only student athletes since the U.S. Supreme Court upheld this type of testing. Some schools have begun drug testing all co-curricular students or students wishing to drive to school. This latter action was challenged in Rush County, Indiana, and upheld by the district court. When appealed to the U.S. Supreme Court, they allowed the district ruling to stand. Schools that contemplate a drug testing program must first document their student athletes are using drugs to comply with the U.S. Supreme Court ruling. Likewise, it is imperative that they rally community support for such a program in order for it to be a helpful tool used by both my school officials and parents. Urine drug testing is the industry standard and recommended over hair and saliva testing, which may not be defendable in court. Early court cases: Shale vs. Tippecanoe School Corporation. This was in 1998. The school district required random drug testing for athletes, which at this time was contested by two students. The U.S. District Court deemed the policy constitutional because the school district had prior problem with illicit drug use amongst its student athletes. The drug testing policy clearly stated that a positive test would not result in suspension or expulsion from school. Students who tested positive would be referred to counseling. No drug enforcement would be involved in any positive tests. Another court case: Vernonia School District in Oregon versus Acton. This was in 1995, and the Supreme Court upheld suspicionless drug testing of all student athletes. The school district had a documented pre-existing drug use problem, particularly among student athletes, which school administrators claim led to severe disciplinary problems. Drug testing of student athletes became established as constitutional because the U.S. Supreme Court stated that student athletes already had lower expectation of privacy and their safety could be affected by drug use. Another case: Willis versus Anderson Community School Corporation. This was in 1998. Willis served a suspension period for a fight after school. After returning, he was required to provide a urine sample. Willis refused and was once again suspended, and if he was suspended a third time would have resulted in expulsion. The Seventh Circuit Court struck down the school policy of drug testing students who had been suspended for fighting at school. This was one of the only court cases where a student won against a drug testing policy. Another one, Earl vs. Tecumseh Public School District 2000. U.S. District Court for the Western District of Oklahoma upheld mandatory random drug testing for students who participate in extracurricular activities, not just athletics. The court stated that drug use thwarts the mission of schools and disrupts the learning process for all students, and drug use among adolescents poses even more severe health consequences than for adults. This was also upheld in Joy vs. Penn Harris Madison in 2000. What does all this mean? Although the legality of drug testing adolescent athletes has been upheld by the U.S. Supreme Court, there has been no prospective controlled studies to substantiate the prevention efficacy of biological testing programs, according to Goldberg et al. In 2003. Types of testing programs that are available. Drug testing programs can be mandatory, as with interscholastic student athletes, voluntary as part of a student assistance program, or based on reasonable suspicion only. Random urine drug testing by far is the most deterrent to drug use by students, since the students may be selected at any time for testing. This type of program gives the students another reason to say no. Such programs require more testing be done, which alleviates the total cost of the program. Voluntary programs do help those students caught breaking the rules by using drugs or alcohol, but has little impact on students using and not getting caught. Reasonable suspicion programs are very effective at keeping drugs out of schools, but have little difference to use by students in general. The banned substances. Currently, the most certified laboratories offer a standard substance abuse panel 10, SAP-10, which screens for the following 10 drugs: amphetamines, barbiturates, benzodiazepines, cocaine, marijuana, methadone, methaqualone, opiates, phencyclidine, propexafine.
My name is Sharon Levy. I'm a pediatrician at Children's Hospital Boston, which is affiliated with Harvard Medical School. Laboratory testing for substances of abuse, or drug testing, has been recommended by some as a method to detect and deter drug use by adolescents. The U.S. Supreme Court has established that it is legal for schools to test students engaged in extracurricular activities. Parents can also purchase home drug testing kits, and several internet sites that market such kits recommend that parents establish home drug testing policies. However, random drug testing, whether at home or in the school, is a controversial issue. Scientific research has not established the efficacy of drug testing adolescents, and the risks of this procedure have not been fully explored. One large cross-sectional study found no difference in marijuana or other illegal drug use by students in schools with drug testing programs compared to those without such programs. Another pilot study of a random drug testing program found a significant decrease in drug use by athletes attending a school with a drug testing program compared to a similar school without such a program. A larger study of drug testing intervention was inconclusive, with decreased drug use in the schools with drug testing at some time points but not others. Athletes at the drug testing schools, however, tended to adopt attitudes associated with increased drug use. Based on the results, the investigators cautioned against broad implementation of school drug testing programs. Drug testing is a complicated laboratory procedure with a substantial proportion of tests susceptible to interpretation error. A student may be falsely accused of illicit drug use if the student is taking certain prescribed or over-the-counter medications. Perhaps even more importantly, a drug test will be negative even after a student has used drugs if the specimen has been tampered with, if the window of detection has been missed, or if the student has used a substance that is not detected by the test. In some cases, adolescents who are unwilling or unable to stop using drugs may employ dangerous methods in an attempt to avoid detection or escape the feared consequences of a positive test. Drug testing is also expensive, and random drug testing programs might divert resources from other treatment or prevention programs. The costs and risks associated with drug testing in schools and at home have not been systematically explored. Based on the available information, the American Academy of Pediatrics recommends further scientific study of drug testing. The Academy does not recommend school-based drug testing programs or home drug testing.